Dr. Jawad, should I start? I think I should start.
Yes, yeah, we can start.
Bismillahirrahmanirrahim. Good evening, ladies and gentlemen. I welcome you on behalf of National Research Council to this webinar on the nuts and bolts of a research project. This is your host and moderator, Muhammad Abdullah. I am currently studying in third year MBBS at National Medical University, Multan, and I have been working on some research projects and have been able to publish 2 of them so far. Moving on to the session, I would again like to welcome you all on the behalf of National Research Council. I am most thankful to Dr. Zishan, Chair NRC, and Dr. Edbaz, Co-Chair NRC, for arranging this, but unfortunately they couldn't join us today as they were traveling. Today, we have Dr. Bilal with us, Dr. Jawad Bilal. He serves as an assistant professor of medicine in the University of Arizona, Division of Rheumatology. He's also the medical director of the UA Arthritis Center Clinical Research Unit and the associate director of rheumatology. He's a multiple award winner and has earned the UA Distinguished Research Award twice, Outstanding Resident in Rheumatology Award, and Best New Investigator Poster Presentation. In addition, he was an honoree of the 22nd annual meeting of the International Society for Pharmacoeconomics and Outcome Research, winner of the poster presentation competition of the National American College of Physicians annual meeting, and co-award winner at the Regional American College of the Physician annual meeting. Above all, he's our vegetarian. He's a senior. He's our senior. He has done his MBBS in 2012. So, very welcome, Dr. Jawad.
No, thank you. Thank you for your kind introduction. Can you hear me well?
Yes, we can.
Okay, I think let's start. So yeah, I mean, as Abdullah was saying, I am a graduate of 2012 and 56, and I did not do house job, and I gave my all steps exams in 2012 and part of 2013. So I applied in 2013 match. And I have done a residency from University of Arizona too, and then I was the chief resident there. Then I did fellowship from there. So now I am in the faculty at University of Arizona. So let me share my screen. You can stop me anytime if you have any questions. So you can all see my screen.
Yes, we can.
Correct. So we're going to talk about, so this is a very unique topic, nuts and bolts of research. So you can see that I have put project in, brackets, because when I was creating this lecture, I thought, rather than just talking about a single project, we should just talk about how to approach the research, or, how to get it started. And then what's the bigger picture here, short term and long term. So that's what we will try to cover today. Hopefully it will be helpful for you. So I have no disclosures. So these are our objectives. So we're going to talk about why this is important, what should we consider, what are the different type of research, and when you start a research, then what are the stages of project, and how do you get it started, how do you write it, and then how do you work in a research team. So these are, you will see the theme is all basic, and then how to approach everything. So I will start with why participation in research is important. So first of all, it's always about the patient care. Whenever we talk about the medical research, we are hoping that we are going to advance medicine, we are going to contribute something, and then by doing all that, we are going to improve the patient care. So that's the foremost important goal. Then the second thing in this journey you gain is a skill development. So all of you, if you start doing medical research, you're gonna start gaining new skills, which can include, working in a multidisciplinary team, or it can include thinking critically, and it can include when you are seeing a patient, how to think differently than others, or if you are reading a paper, then how to think differently than others, and to question everything, and then to find answers. So those are all the things I think in this journey you can acquire. And then this gets better and better, your all these skills. And then overall, I think participating in medical research makes you a better clinician too in the end, because you think differently. Then of course, a teamwork. These days the research is all about multidisciplinary teams and collaborations, nationally, internationally. And pandemic has actually made it a lot easier, because now we are very familiar with all these online platforms like Zoom, like we're using today. It was not very easy before this. So this has had a great impact on the research field too. So now we collaborate more with the other universities nationally, and then we are doing more international collaborations. And then when you work in a team, then you learn how to work with others, how to utilize each other's strengths, and how to know the weaknesses of your team, and how to make all of this work. And this all then translates into your clinical practice too. When you're working in a hospital, then you are a team too, and you have a trainee, you have a faculty, and then the other people who are helping you. So they all are part of your team, students. And so working in this team can help you work better in your clinical team at your hospital. Then the career prospects, I put it in the last because I do think that it's one of the important reason, but it's not as important. Right now, if you think about the research and career prospects, so research can open more doors for you. And if if you collaborate nationally, internationally, and then you have publications, then wherever you apply, it is considered that you are better than others. So that's how it opened more doors. And also, if you are looking for a training position, then it also helps you having a research background, knowing that you have some research skills, knowing that you've already published, and knowing that you can do it. So that's how it helps in the career prospects too. And some people become physician scientists after doing the research, so that actually makes a career for them too. So that's one of the key reason why we do clinical research too. So I think before you think about doing medical research or starting it, so you need to ask few questions to yourself. And so why are you interested in the research? So there can be many reasons for it. Like we talked about why research is important. So it can be because you want to contribute into medicine, or it can be that you want to see how you can work with the nationally and internationally with the other research teams. And it can be for your career prospect. Maybe you're applying for a training, maybe you're applying for a job. So whatever your goal is, you just need to be clear about it. So that you're if you're working with a research mentor or you're working in a research team, so they know what you are looking for. And then all of those goals are I mean, having even one of those is great. I mean, you just need to know it. So it's, I mean, if someone is just doing it so that they can improve their career prospects, like getting a training position or finding a job, or even becoming a physician scientist, then that's okay too. So there is nothing wrong in it. So just be clear about it. And then the second important question is that how much time do you have available? You all are medical students, and then you have your other obligations too, and then you're studying too, and then you have your exams. So between all of that, you really need to sit down and figure out before you start doing it or approach anyone, that how much time do you have, how much time can you spare, and then what will be your commitment duration, short term, long term. Those are very important questions. They are very important to your research team or your research mentor or whoever you're working with. And what do you want to get out of this research experience? That's something to think about, yourself. Again, if you just want to improve your career prospect, that's great. If you want to become a physician scientist, some people just like it and then they pursue it as their career, like Dr. Riaz is doing it, and he's a physician scientist. So if you want to do that, that's great too. If you want to do a mixture of clinician and then doing some research, that's okay too. You just need to know before you start it. And you may not know initially, but you may have an idea. Having an idea is enough too, but you need to think about these things before you starting you start the research. So we're going to talk about some basics, which I learned, during my journey of learning how to do medical research, and I thought that these were very important, and I am not sure how the medical school curriculum is right now with regards to research. When I graduated, I did not know anything about it, and I have never written any case report. I never even thought about doing research, so I had to learn everything. And fortunately, I had good research mentors, and they helped me. So I hope that these are the points I'm going to make in next few slides are going to help you, which I gathered in last few years. So learn how to write email. So that's very important. I think that's a start, because even if you are, thinking about doing research, you're going to start doing emails. This email can be to getting an opportunity and contacting a research mentor, a clinician, or whoever, and maybe communicating with your research team, anything. So you really need to know how to write an email professionally. When you write an email, you need to ask someone or yourself, check for grammar and punctuation mistakes. They can happen, they're very common. And lots of, very esteemed and renowned people in academics, they don't like it if there are any mistakes. And that create a bad impression too in your first interaction. You can use some online free apps too. Grammarly is the one which you can use to check for grammar and punctuation mistakes. And be concise. I get almost 20 to 30 emails every day. And then when I talk to chair of my division, he gets almost 40 to 50 emails every day. So you have to be concise, because lots of people, who are interested and they want to work with you, they're willing to help you, but they don't have, that much time. But so it will be helpful if you write an email which is very concise. So what I will say, it should just be not more than 2 paragraphs, and each paragraph should be like 2-3 lines. So it has to be crisp and concise. And you have to be humble. You can tell anyone about your strengths, and you should also mention your weaknesses then there too. Overall impression of the email should be, it feels like that you are a humble person. And trust me, if you write an email and it's not giving that vibe, the other person can tell that. So it's very important, and you have to be patient. So like I was saying, that there are so many emails people get, they have to respond to. So maybe they will not respond to you in a day or two. They may respond to you in 5 to 7 days, or maybe in 7 to 10 days. So usually, unless it's an urgent email, I don't respond it within 24 to 48 hours. I keep flagging them, and then I respond them on my weekend, or whenever I have time, half day off from my clinic or other duties. So just be courteous and mindful when you are emailing. Be sensitive to cultural differences in writing. It may not be the most important thing, but I think it's important for us to know. Like, I will just give you an example. Here, what I can tell you, that here they don't use sir and madam, words a lot. So everyone is like, if it's let's say Dr. Zishan, so they're not going to call him, I mean, his name is Muhammad. His first name, if they're going to call him his first name, it's going to be Muhammad. So his last name is Zishan, so they're going to call him Dr. Zishan. Like Arbaz bin Riaz, they're not going to call him Dr. Arbaz, they're going to call him Dr. Riaz. So they all, whenever they're calling formally or professionally, they are gonna use the last name like Dr. Riaz, Dr. Zishan, or Dr. Khan or Dr. Ullah. I'm just reading out your names. So that's something, when someone sees, the first name is just looks a little different. It may not be a big thing, but it's good to, know the culture here. And again, as I was saying, they don't call sir and madam. They just use doctor. And they're very careful, when you're ending the email, like you have to say respectfully or regards, or something like that. And then you have to put your full name and then your title. Let's say Abdullah is medical, he's in third year medical student, so he's just gonna say MS3 at Nishtar Medical University. So they want to know your titles, from in your after your name. So those are small things just to be aware of. And then always attach your resume, especially if you are contacting someone that you are interested in research. Just attach your CV, and it doesn't have to have anything. I mean, even if you don't have a research, that's okay. They just want to know what's your background, what you have been doing, and where you stand, because they can make a decision after looking at your CV. If you have not done anything in the research, so they may, like if you're asking someone to work with, so they may attach you to a person who is really good in research, and that person can help you. But if you have experience in research, so then they may attach you to someone who does not know much. So it just helps them to decide where to put you in research team, or what how to go along with you. So that's the main purpose. And if you don't know how to make a professional CV related to medical field, you can Google it or watch it on YouTube video. There are so many YouTube videos, or on Google there are so many examples. So your resume should be it should be very nice, because that's going to give the first impression whoever is going to you're going to contact. So then find a mentor or research supervisor. I think without finding a research supervisor or mentor, or it's going to be really difficult. Even if you have done some research, but if you want to, let's take two examples. There is a person who has not done any research. There is a person who has done some research. If someone has published one or two papers. So the person who has not done any research, so it's very important for them to find someone who knows how to do it, who has published a lot, with a lot of experience, and then who has a lot of resources. And so that's why it's important to find a mentor or research supervisor for that person, or someone who has done some research. Let's say if they're published one or two articles, or they have worked in phase 3 trials as a sub investigator. So likely they want to advance their career or their research prospects. So then it is important for that person to find someone who can do that, who can help him or her doing that. So that's why I think the role of mentor or research supervisor is going to be key. So that's something, it's one of the basic you need to start with. So don't hesitate to reach out to anyone. It doesn't hurt to ask nicely. So you can ask anyone. I mean, let's say if they say no, or even they don't respond, it doesn't hurt. Then email is preferred, because most of the research are not on the Facebook, what I have seen. So that's why it's just get yourself very familiar with the emails, and then try to have, I mean, I did not mention it, but I want to mention it here. Try to have an email address which is professional. Like it can be your first and last name or something. It should not be I'll just say this should not be cotton candy or something. I mean, I have received email from email addresses like that. So it should be very professional, the email address. and then familiarize yourself in the online platform like Twitter. I am just gonna say Twitter because what I have seen, lots of people who are very big name in the research, they are on Twitter, and then they keep tweeting their new research, new opportunities. Let's say if they need someone for a research project, they want to recruit someone, they just tweet there on Twitter. And it's very different than Facebook. It's very easy. I had hesitancy too, but since I have started using it, I just keep asking myself why I didn't start it earlier. My main source of education at this time is Twitter, uh, believe it or not. So it's very important that you familiarize yourself with all these. Follow people in the clinical research or field. Let's say Dr. Zishan is doing research, you can follow him. Dr. Naveed is doing research, you can follow him. Dr. Riaz is doing, so you can follow him. uh, Whoever is doing the research, you can follow them. Follow people who are exceptional in research field you like. Let's say if you like epidemiology or infectious disease, then you can follow Dr. Fauci, who is leading the pandemic here. And similarly, if you like someone, if you like cardiology, then try to find someone who is a very big name in cardiology. Or if you like general surgery, just try to find someone who is a big name in surgery. So, and then Twitter is very smart. So once you find one person, then Twitter will keep suggesting you to, add others. And then most likely that person is connected to all other big, names too. So it's just going to help you. So once you find one, then you can find others too. It's going to be very easy from there. I think finding the first person is going to be the tough. And then you can ask your research mentor supervisor too, if they know someone who has done exceptional in the field you like. It can be nephrology or anything. Look for online posting for virtual research collaboration and apply. So I put this in there. I was interviewing for rheumatology fellowship positions last month, and then I interviewed a candidate who worked with a uh, uh, very big researcher here in rheumatology in US. And I asked her, how do you know him? She said that I follow him on the Twitter, and then he posted that he needs some help within a project. So I just sent him a message, and then we started working together. And then she published with him like 2 3 papers. And then you have to keep in mind, if someone is a very big name, so then they are going to publish in a very good place too. So I was amazed, actually. I did not think it like that. So I keep telling my all mentees and students and my fellows trainees that you really need to start using Twitter, and then you need to look for all those opportunities. And it won't matter to them that you're sitting in Pakistan or anywhere else. They can just work with you, because it doesn't matter. That person who I'm talking about, she wasn't from US too. She was from somewhere else, but she did her training here then. And then don't miss the full-time research of positions. Let's say this will apply to students who are in their final year, and or they are in their in-house job, if someone is in, or if someone is residency, and they are looking for a physician scientist career, or they want to do something in research. So there are postings for full-time research too on Twitter. And then they give you a link and you can apply it, and then those positions are really good. I have seen so many people uh, going through those positions and achieving a lot. So I think Dr. Rasim Tariq, I think she's a Nigerian too. She applied for a full-time research position in Mayo, Minnesota, and then now she's a GI fellow at Mayo Clinic. So she went through all that process. So don't ignore those opportunities. I mean, if you can go, and they are usually paid positions too. So you are able to support yourself very comfortably. Follow journals like New England Journal of Medicine, Annals of Internal Medicine, JAMA, all the big names, all the big journals. Start following them and try to read the articles. You may not be able to read all of them unless you have access, but there are going to be many free articles. Like all the COVID articles, COVID related, they are free on all the journals. You will be able to access it. If you're working in a research team, then they can access if an article you like, when I work, with someone. So if they don't have access, we usually make a folder of all the full text PDFs and then give it to them so that they can, if they're doing data collection or whatever. So just start doing it. You will find ways how to find the full text articles. Be honest about your potential experience and expectations. That's the most important thing you can do. It's okay to say I don't have any experience in research. But it is important to say I'm willing to give my best and will put my best effort, though I don't know anything. And that's completely understandable. Lots of people, we start working, they don't have any experience in research, clinical research or translational research or basic science research, which is okay. I mean, you are a student, or you are a trainee, and that's why you're here to learn, and that's important. So if you want to learn, and then you're willing to give your best, then that what it all matters. So be very honest. Like I was saying earlier too, that they're gonna assign different responsibility or tag you with the other team members based on what you're gonna tell your research mentor or your research team, and based on your CV. So try to be honest there. Once a task is given to you, do one simple thing, even if you don't know anything. I am going to keep saying this again and again, and I cannot, emphasize enough. Google it or type your question in YouTube. So there are so many things related to medical research. They are available free. Uh, you can Google it. They're going to be on the Google, or YouTube has so many videos. I have learned so many things from YouTube videos too. So don't hesitate. Make it a habit of doing it. I will give you an example. How to create a table in the Microsoft Word, how to add columns in Microsoft Excel sheet, how to find a particular word in a PDF file, how to create a poster in the PowerPoint. There are so many good videos about that. And what is the difference between systematic review and meta-analysis? So those are some of the examples. You may or may not know. I did not know anything when I graduated from med school. And then that's how I learned. From my colleagues too, I learned, and then working in a research team I learned. But then always try to Google it yourself or try to find the answer, and then you can ask your team to, oh, I found this, I'm doing this, is it correct or not? Sometimes, most of the time, your team may ask you to create a poster. I mean, lots of us have never created a poster in PowerPoint. I had never done it when I was in medical school. So I had to learn it, and then it was very easy, believe it or not, after watching the YouTube video. Tell your team about your strengths. I'm going to give you examples. I'm great at creating tables in Microsoft Word. I have done online Microsoft Excel courses, which lots of them are free, so you can do them. My English is very good. I can be helpful in writing. I can create good posters in PowerPoint. I can do data collection really good. I'm good in reading through articles. I have recently learned how to perform a quality analysis of clinical trials through free YouTube video. There is a YouTube video for that too. So those are some of the examples, and these are some of the things you can actually do before asking someone, before applying for a research position, because all these are very basic things, and they all are free. They're available for you to access. No shortcuts. I don't think so. There is any shortcut. You will have to do it, and then and you have to do it right. No plagiarism. I'm going to talk about it a lot more, what it is, and then what are the consequences. So no copy pasting. It's with it. It unfortunately is very common. So I will tell you that I am reviewer for a few journals too. They have these softwares, very sophisticated softwares, and then they go through the millions of articles throughout the world, and then in matter of seconds they can tell how much plagiarism is there, copy pasting. 5%, 10%, 15%, 20%, 30%. And then once a journal know that there is a copy pasting in the article and it's a lot, then they will never accept any of your publication ever. And then if someone let's say if someone has copy pasted ideas or wordings of from other article, and that author have seen that paper, so then he or she can reach out to that journal and then they can complain. And once they complain, then you have to retract the article, and then they notify wherever you work. Let's say if I work at University of Arizona, they're going to notify my division that I was caught in plagiarism, and then they retracted my article. So it's a very big deal here. Support and involve your junior and colleagues. You can I can never do research alone, and I have seen most of the people can never do research alone, and everyone has their strengths and weaknesses, and so that's why even if you involve other people, everyone is just going to get what they deserve. And then it create opportunities, and it creates a support system, and it create a healthy environment. So I will always encourage you to support and involve your colleagues, your seniors, your juniors. If you know something, tell them about it. If you have seen a good YouTube video on, making a poster or, doing an analysis, share with all of your, colleagues so that they can learn too. And trust me, there is no end in research. It's like poetry. One thing lead to another. So, there are always going to be opportunities. So don't worry about that. Start reading articles from good journals, like New England Journal of Medicine, like we talked about, because that's how you will get familiarize yourself with the research, and then how people write it, and then what they talk about, and you may come up with ideas too after reading those. I browse most articles mostly through Twitter feed. As I told you, that's my biggest learning resource, Twitter. So whatever new articles are there, I go through the links. If they're free, I can just read it right there. If they're not free, then I need to get access through my university. So, but since I will tell you. So I'm a rheumatologist, so I have subscribed, liked on Twitter all the rheumatology journals, and then all the people I like in rheumatology field. So when they talk about an article, or there is or journal is saying, oh, we publish a new article, so then I read it, and that's how I know about it. And that's how I am updated in my field too. It's very easy to do it. So you can, that's how I am almost about to delete my Facebook from my phone. So you can delete the apps you are spending a lot of time on. So you can just then open the Twitter, and then I on my Twitter I don't have any of my, not any of my friends, yes, no one, and nothing else. I just have the journals. I have people I like in rheumatology field. So it's all, there is nothing else on my Twitter feed. So that's how, I mean, it's our common habit, just to pick up the phone and start, browsing. So you can learn. I learned a lot when I pick up my phone every time. Read aims, methodology, strength, and limitations carefully when you're reading a paper. Come up with your own strength and limitations of the paper. That's how you're going to start thinking. That's how you're going to start thinking critically. Then you're going to have your own questions about clinical research, or like COVID-19 is a great example. There are so many low quality papers which you read, and you can say, oh yeah, they didn't do this right, they didn't do this right. So I don't agree with their conclusions. But this comes with practice, so don't worry about it if you don't get it initially. Just keep reading. Look at the presentation style and language. Medical writing is different. It's not like writing an essay or in English or something else. It's very different. The words are different, and the way you present everything is different. So once you start reading more and more and more, you will know. And then there are the similar words everyone use, and because it's overall, in the end it's a medical field, so they're going to use the medical words. So try to read. So what we'll have to mute someone else. Okay, so what constitutes the foundation of a successful research project? If I have to say one thing, creating or finding the right team. This is what I have learned through many years. So the very reason is that research is very multidisciplinary now. So I'll tell you, there is a mentor and a senior author. There is a biostatistician who is going to run the analysis. There is a librarian who is going to find articles for you. You and your other colleague will help out, maybe initially with data collection or doing something else. Then another colleague will cross check the collected data. Then there is a feedback from another expert on the topic. And then someone has some particular skills which has to be involved, like grade methodology. Grade is like way of grading the strength of the your conclusion. Let's say if you did a paper, you say, oh, this drug is better than other drug, and then there is a whole methodology of uh, uh, grading your conclusion. So that's called grade. And quality assessment of studies, of the clinical trials or observational studies and all those. And I don't know. I mean, I know grade, but I don't know quality assessment. I don't know all of it. I cannot do a work of a librarian, and I cannot do complex analysis. So you really need help of other people. And then that's where the most important things come for you. So if you are one of these, so you are going to be a very resourceful person for research team. Let's say you know how to do great, and you can be very resourceful. Let's say if you do a quality assessment of such studies, you can be it can be very helpful. Okay, I was just checking. So, so I mean, so look at it. This is just, I am giving you an example how these are all people are going to be on the paper. So you can see 1, 2, 3, 4, 5, 6, 7, 8. So if you are doing a good paper, then there are going to be 8 to 10 authors. If it's, let's say, if involves a lot of data, like maybe more than 30, 40 trials, or maybe more than 30, 40 observational studies. So it is really multidisciplinary, and no one can know all of it. I will tell you, I have worked a lot. None of us, me, Dr. Riaz, Dr. Zishan, Dr. Naveed, none of us know everything. So we all, what we are trying to do is we're creating the team, the right team, and then and everyone is learning something, and then that's how, and you move along. You do need a basic study design, which you need senior author for. Let's say if you're working with Dr. Riaz or you're working with Dr. Naveed, so they are the senior author or your mentor, and then they are creating the design and they are giving you input on everything, but they may not know everything. So that's why it's important to get a skill. So if I have to say one thing in every slide, I will say that just try to learn a skill which is going to be helpful for every research team. Like something, I'm just giving example, grade methodology, quality assessment, something. Then, so now we are going to go into a little bit what are the research types. So now we know all of it. what is in the background going on, what should be going on in your mind, or what you should have been doing before even thinking about the type of research projects or writing or publication and all those. So there is a full-length methodology research called original articles. These are RCTs, randomized clinical control trials, observational studies, systematic review, and meta-analysis. They all come in this. Then there are letters, rapid communication, short communications. So letters are, let's say, if someone has published a paper and then you want to write to editor and tell them, oh, I think, they made this mistake, or this is your point of view on that. Sometimes you have observed a very unique finding on your patient, and you have the basic science evidence to support it, and you have labs or genetic testing, so then they can go as a rapid communication or short communications. Then there are case studies and case report. Case studies are, you have more than one case, and case report is only one case. And there are review papers. Usually, if review paper only carries much significance if it is if involves an expert, someone who knows the field. Otherwise, they are usually not published in a very good journal. I mean, you can write it and then it may be published in low quality journal. But if you want to publish in a medium tier or very high quality journal, then it has to involve an expert on that topic. So what is going to come out of it? Let's say if you do all these projects, so you can have a peer-reviewed publication in a PubMed index journal. So that's I will talk about it. What is PubMed? So you're going to have a publication, and then the other outcome can be conference presentations. So you can submit your paper or your the abstract as an oral presentation in a conference. Like if I am working on something in rheumatology, let's say I like psoriatic arthritis, and I'm looking at interleukin inhibitors in psoriatic arthritis. So I can submit it in a American College of Rheumatology meeting, which happens every year. And if my research is good enough, then they're going to accept it for oral presentation there. And otherwise, they will accept it as a poster, or sometimes they reject it too. So those are the other outcomes. So not everything is going to be published, you need to remember. So you can just present it in oral or presentations or poster in conferences, and they carry a lot of significance too, especially when someone is looking at your CV, and they're going to look at it. You have presented in several different internationally and national conferences. So it carries a lot of significance. And then abstract publication. So every paper has an abstract. We will talk about it, what it is, if you're not aware. Though, so the app. So let's say I presented my poster in American College of Rheumatology meeting. So a lot of big, meetings, conferences like American College of Rheumatology, American College of Oncology, American College of Gastroenterology, whenever they accept something for poster or oral presentation, they publish it too. So you can access it online. So that's called abstract publications. Abstract publication are searchable, through Google Scholar, and you can see them. And then some of them are on PubMed too. So they carry a lot of weightage too. So those are most three potential outcomes of if you do a project. So now what is PubMed? So PubMed is a database, contains more than 33 million citations and abstracts of biomedical literature. It's biomedical, so it has other things too. It does not include full text. However, links to full text are there when available from other sources, such as publisher website or PMC. Let's say if someone, there is an article in New England Journal of Medicine, so there will be a link to the journal. So now if that article is free, so you will be able to read the full text. But if that article is not free, then you will have to get access. Like I go to my University of Arizona website and log in through that website and get access to full text. And then you may have other resources too. So your team can help you getting the full text. So this is an example of, PubMed. So I just typed in COVID-19 vaccine. These are the articles. They come, you can see a free full text. You can click and then see which one has free abstract, full text, and then by years too. And, you click this and then it will take you to the link. And these are the authors and, all this. So this is called PubMed. So the most important outcome of your research can be if you work on a research project and it published in the PubMed index journal. So which means that your paper is here. So if I type in your name, let's say Abdullah, and then it should come up that, this is Abdullah's paper, and then it's in, let's say, PLOS journal, and then, this date, and it has an ID. That's the most, best outcome of your research. So this, when we talk about stages of research project, conception of an idea, come up with a hypothesis, it may be you, or it may be your research team, or it may be your research mentor. Writing the protocol. So first, whenever you're starting a project, you need to write it. What are you going to be methodologies? How you're going to do the analysis? Who are you going to include? Who are you going to exclude? If you are working on a systematic review, what is your exclusion criteria? Which articles or trials you're going to exclude? What will be the reason you're excluding those? This all need to be sorted out before even you start collecting the data. And then ethical approval, if you work with a team who is doing an, like, say, observational retrospective study. Let's say I'm doing in University of Arizona, so I'm looking at the patient charts, from my rheumatology clinic. So then I need a approval. It's called IRB approval, Institutional Review Board approval, uh, before I can even access those charts. So then, you need that approval, and there is like a whole form. And then if you're gonna be working in research field, there you will, see that because all the observational studies which use the real patient data from the hospital, they need the ethical approvals. And it's not big deal, they approve it if you write everything wrong. You need to clearly state your, objectives and methods and what are you hoping to achieve. So that sort of things. But if you are accessing a data which is already published, let's say randomized clinical control trials, you don't need ethical approval for that. It is only if you are going to use real patient data by yourself. Then methodology, the analysis, and then decide a best way to disseminate your finding. But mean, what are you going to do when you have your, paper ready? You're gonna you're gonna present it at a conference, or you're gonna just directly submit it for a publication. And if you are thinking about this, where are you going to do it? So I will tell you, most commonly what happens is that, let's say if someone is working with me, so then whatever project we are working on, we try to present it at American College of Rheumatology meeting. So, you're going to have a poster presentation there, and then you're going to have an abstract publication too, because it's going to be published online. Then after that, we submit it for a publication in a PubMed index journal. And then we decide, depending upon how good the work is, what kind of journal it can be. So you're going to have from the same project a poster, an abstract publication, and a peer-reviewed full text publication in PubMed index journal. Then, so then when you're writing up in format required, you should write format required by your chosen journal or a conference. Everyone has their different, requirements. Submitted constant apps for conference abstract, you may hear soon. And usually they have a deadline. They're going to tell you in a month or two. For publications, it may take, over a year. That's a very important thing. I tell everyone who starts working with me, because when you start a project and then when you're ready to submit it, depending upon how fast, how quick you work, it can take anywhere between 3 to 6 months. And then after that, when you submit it, then it has to be peer reviewed, which means someone has to review it. independent reviewers. So it takes almost anywhere between 1 to 3 months. So, and then after that, there are only, I think, 10 to 20% of papers which are accepted right away. So if it's not accepted right away, they may ask you to revise it, they give you comments, or they reject it. So then you're talking about another 3 to 4 months. If they ask you to revise it, you're talking about another month. So that's why it's important to start early and think, start thinking about it early. So now you know all that, how to get started with a project. Now you're thinking, that I want to do it. So what to do? It's always helpful to start with the research team. You can learn new skills. You're never responsible to do everything. So try. So like I said, the most important thing is finding the right research team. You learn by doing it. Always don't hesitate to start something. Everything will come to you in pieces, so you just need to start doing it. When contacted, a member of a research group or even mentor, ask if they or someone else with their team would be willing to offer you some research experience or skill. Like, they can teach you something, they can teach you how to do quality analysis, or they can you have already watched the video, now you just want to see the software part. So they can go through that, they can go through how to make a prisma flow diagram or something like that. Read the work of team's research mentor, and see what team has been doing. This is very important. When you're contacting someone, just try to know about them before you contact them, because it shows effort on your part. So let's say if you are contacting Dr. Zishan's team or Dr. Sadiq Naveed team, so you can easily Google it and then see what Dr. Zishan has been doing, or Dr. Naveed has been doing, or Dr. Riaz has been doing. And then you can see if it interests you. And then, so then when you're talking to them, they know that you know too what they have been working. It is important to have a flexible approach to what they offer you. This is very important point. You It may not initially sound very exciting, but it will be necessary part of your research process and may lead to more interesting research activity later, because most of us initially don't know anything. So that's why we have to be very flexible what we have been given. And then once you enter into research team, and then they know you're hard working, and you're honest, you're dependable, you're trustworthy, then they will give you more and more. And then you will start your journey towards becoming a first author in a very reputable journal. But it's not going to start like that. So you have to be flexible initially. So when you're writing up, read about the topic you're working on thoroughly. You need to be an expert on the topic after you're reading. Let's say if someone let's say if I'm working with someone who is we are working on psoriatic arthritis, so you need to know about it. Psoriatic arthritis, what it is, epidemiology, pathogenesis, clinical manifestation, treatment options, what is new, what are in the news, what is in the news these days. So those kind of stuff, you really need to be an expert. Otherwise you will struggle a lot. Use every resource you have to learn about the topic. Reading same topic from different resources is always preferred. Always, even if for your day-to-day clinical work too. Read same topic from different resources. It gives you different perspective. Books are a good start, but they are usually outdated. For research purposes, books don't have that much role because they are always outdated. Because for research, you're doing something which is new. You want to tell something, you want to tell the world about something which you think it's new, or new finding. So that's not going to be in the books. But it's always a good way to make your base. Review articles in the reputable journals are always helpful. Whenever I want to know about a topic, I start browsing it to the review articles, and then I write like New England Journal of Medicine, or Annals of Rheumatic Diseases, or Nature Reviews Rheumatology, like very highly respectable journals. And then those articles are really very good, and they are very and they can tell you the year too. So if they are in 2019-20, they're up to date. Begin by organizing what you have read and collected, and make a rough draft. You can revise the rough draft as many as time you think necessary to create the final draft. So that's how I would approach it if I have been given, an opportunity to write a paper. So these are the individual component. Title, keep this simple and concise. Abstract, it's usually on the top, usually 200 to 250 words, should be written in the style of the journal. Generally, it has every section, but very like a liner or two-liner. Background, methods, results, and conclusions. They are all in 250 words. It's very difficult to do it because you have to do it right. Otherwise, the reviewer is not even going to read your paper if he or she doesn't like the abstract. So it's very important to write a good abstract. Introduction is usually 1 to 2 paragraph. Don't talk about result, discussion, or conclusion. That's the most common mistake. First paragraph sets the scene and summarizes the current literature. Second paragraph should justify why you're doing this. And let's say if you're, working on, uh, let's say if you're writing a case report, and why are you writing this case report? Why is it important? Is it a unique finding, or is it something new, or is it a unique presentation? You have to give a reason. Patient methods, most frequent mistake in this section is to include results. The results are not here. This is just you're describing what are you going to do. Study population, how data was collected, how crucially, and how analysis were undertaken. So this is just how you designed your study. We are only talking about the design and methodology. The results are going to come after this once you have described this. So then results should be presented concisely. People always like figures and tables. So use less words as much as possible. Discussion has a few components. The first paragraph, what are the main findings of your work? Second paragraph, how do your observation compare with other work in the same area? So you compare your work to others. The third paragraph, what are the clinical implications of your work? Fourth paragraph, what are the strengths and weaknesses of your study? Fifth is, what are the suggestions for future research? So every discussion almost have all of these, headings. And when I used to write it initially, I would copy paste all this, and then I start filling in these, and so that I know what I'm talking about. So these are 5 paragraphs almost in the discussion. References are the last part. Make sure they're presented in the style of the journal you have selected. So every study you're going to quote, everything you're going to say need to have a reference. Let's say if you're saying the prevalence of rheumatoid arthritis is 1 to 3%, you need to have a reference for that, and that reference goes into the references. You're going to say COVID-19, there is the Moderna works for COVID-19 infection. You need to have a reference for that too, although it's everyone knows it in the world, but you need to have a reference. You need to put that trial which proved that Moderna works for to prevent COVID-19 infection. So everything needs a reference. Whatever you're saying, it's going to need a reference. If you're saying a disease is more common in male than female, you need the reference. If you're saying disease is more common in young population than the older population, you need a reference. So literally everything is going to need it. You cannot cite anything without reference. So now we're going to talk about some common mistakes or something to keep in mind. Manuscript writing is like a story. It should have a flow and connection between the different segments. When you read it, you should enjoy it in the end. And then it should be very clear. Background should clearly define your rationale for conducting the study and the supporting evidence. Otherwise, it's not very helpful, even though if you talk about everything else in the world. Be clear in your method section. Describe everything what you have done. Like even for a small reason to exclude a study, you need to write it in the method. Let's say if you have excluded the phase 2 trials, you need to mention it. Let's say if you excluded the trials with incomplete data, you need to mention it. Let's say you don't want to include the abstract publication in your study, you need to mention it. Pictorial representation of results is always catchier. They like it, reviewers. So even if you are doing a case report, try to make tables for the, for your discussion or even your lab results, something like that. First paragraph of discussion should always summarize finding of your study. Don't oversell findings of your study. Reviewers know everything. Don't ignore the weaknesses of your study. Talk about it and acknowledge it. Usually, if overall findings has a particular concern or bias, so we usually talk about in the first paragraph so that readers know, although we are saying all this, but we acknowledge that this is our weakness, and then our results may not be conclusive. They may be hinting toward a particular side, but they are not conclusive. Keep line spacing, font, and font size consistent. Double spaced 12-point times New Roman is preferred. I mean, everyone, whenever you're submitting it, you can just keep this double spaced 12-point. 12 is the size, double space is the space, and times New Roman is the font. You can easily double space the entire manuscript in the Word. Again, if you don't know it, you can just Google it. It's just going to tell you. Use consistent heading style throughout, no more than 3 levels. Learn how to use EndNote software for referencing. This is one of the few things, if you really want to do research, you need to learn it, because everyone, literally everyone use EndNote software for referencing. And there are so many good YouTube videos how to do it, and it's very easy. And then I think there is a limited time free version too, which you can use, but all the research team have it. And then if you're working with them and you know how to do it, so then they're going to share the key with you, and then you can do referencing. So this is something you really need to know. Everyone should know it. Google it or watch YouTube video. Labs always need units and normal range. This is for the case report mostly. Always, everything needs unit and normal range. This is for everything. Define abbreviations on first use in both abstract and main text. CT scan, MRI, EKG, although we think that everyone should know about it, but you always need to define it. Like MRI, magnetic resonance imaging, and then in bracket you say MRI, and then after that you can start using MRI. EKG, you need to define it and put in bracket EKG, and after that starting using it. That's a very common mistake I have seen the students make. So when you have done all that, then you're thinking about the publication of the paper. Never submit a paper without all authors having read it and agreed to the content. This is one of the requirement by the journal too. Never submit a paper to more than one journal. This is no, and it should never be done. Discuss with your co-workers what your target journal should be. Consider journal impact factor when submitting. So what is impact factor? Impact factor reflects the ranking and importance of a journal. Higher the better. Impact factor of 10 or greater is excellent. 3 is considered good. 1 to 3 is okay. Less than 1 is not good. New England Journal of Medicine has impact factor of 74. Not many journals have impact factor of 74. So even if you are somewhere here around 3 or 2, it is great for you. And then 10 is like out of the world, essentially, because New England Journal, they only take papers from like people who are very famous in their field, or they are the leaders in their field. So the publication, remember we talked about peer review publication. So peer review is a process used by journals to select papers for publication. They send it to 2-3 different reviewers. Like if I am a reviewer for JAD. It's a Journal of American College of Dermatology. So they will send it to me, and I will submit my thoughts about the paper. They will send it to 2, 3 other people too, and then in the end they will make a decision. That's why it takes about 2 months, and can take about 3 to 4 months too. If your paper is rejected after the peer review, reviewer comments are an excellent set of suggestions to improve the manuscript. So you can, look at all the comments, try to address them, and then submit it again to another journal. So I will give you some few examples of unethical behavior. Multiple submissions. So you can never submit a same paper in different journals at the same time. You can submit it after you get rejection. Redundant publication, if something is already published, and believe me or not, it has happened when we work in a research team. Plagiarism, again, it's a no-no. Data fabrication or falsification. Data fabrication also include if you're collecting the data and you don't know, and then you just put a simple number in. It's data fabrication or falsification. Improper author contribution. If someone has not worked on a paper or someone has not done anything, then their name shouldn't be there. It's an unethical behavior. So plagiarism is a serious offense that could lead to paper rejection, academic charges, and termination of employment. It will seriously affect your scientific reputation. So never ever do it. Don't do it. So when you now, I think this is my last session part. When you're working in a research team, what are some things you need to consider? You started a project, ask your team if you're unclear about the task. The sooner the better. Just ask them. And then, there are usually in the research team, there are several people you can ask. And it's always helpful that if you know your limitations and you know what you don't know. Update your team regularly about your progress. I cannot emphasize this enough that this is a very important thing. Upgrade your team, update your team every hour or so. Oh, sorry, every week or so. Create a timeline and stick to it. That's very important too. Let's say if I'm going to give you an example. Let's say if your teams tell you, to do a quality analysis of randomized clinical control trials, and then you said you know how to do it and you're going to do it, so you need to tell them, oh, I'm going to do it in 2 weeks. So then you really should do it in 2 weeks, and then you can update after a week your team, oh, I am done half of it, so they know you are working, so there is no like complete silence from your part. So it is the most important thing when you're working in research team, updating and creating a timeline. Always be ready to volunteer if you can. More opportunities to learn and gain. You're going to gain more skills. Remember, we talk about more skills you have, more important you are, more publication you're going to have, more successful you will be. So try to learn, gain new skills. Show interest, be quick in response, and focus on learning new skills. Keep the same things. Can't emphasize enough over this. Try to learn new skills. Data collection is an important part of research. Ask your team if you have any questions. Always ask, because data collection is an evolving process. You're going to have so many questions. Your team will give you an Excel sheet in which there will be headings, and then they will say, okay, so just read the article and put the information in these columns. But it's not that easy sometimes when you're reading the paper. There are so many ambiguities, and then there are so many things are not clear. So just ask them, don't put anything wrong. Data collection is the key to the study, because that's how everything, analysis, results are going to be. Learn how to troubleshoot, try to come up with the solutions. So that's something I have learned along my way. It's always uh, important to come up with a solution on your own initially, and then present that solution to your team. They may or may not opt for it, but even if they don't use it, they will know that you're trying. And then you are just not someone who is just following, something we have given. You are thinking, and then you're trying to improve, and you're trying to learn. Like I said, lots of projects evolve during data gathering. We change the protocol, change things depending upon what kind of data we gather. Think of the things which can be improved or negatively impact the project. So if you are collecting the data, you will be the one who are gonna noticing those factors which can affect the project, or factors which can improve the project. So you should communicate those with your team or whoever you're working with, and then try to then learn whatever you're thinking. Then you can do some basic workup before presenting it to your team. It's very important. Always try to double check the data, always, especially if someone else is not going to do it. Share your short-term and long-term goals with your research mentor so that they know, like, you will, let's say if you have a commitment, you're going to have 6 months, 1 year, or 2 year, it's going to be very important. Team will plan everything around your commitments of individual team members. So be courteous. Let's say if someone is making a commitment for a year, and then after 6 months they achieved what they wanted to through the research, medical research, and they leave. So I think it's the most worst thing you can do, or anyone can do, for to the research team and to the colleagues. So try to set uh, have a time commitment, and then just honor it. Authorship credit, usually is based on substantial contribution to conception and design and acquisition of data, or analysis and interpretation of data. Drafting an article, revising it critically for important intellectual content, or final approval of version to be published. So those are the things which qualify someone as an author. So always keep those in mind. Then, so this is something, online and free. This is one of the online resources I wanted to show you. It is Equator Network. So this is their website. This is the website here, equatornetwork.org. And then you can go into toolkits here. So I went to toolkits of writing research. So welcome to toolkit of writing research. See what they say. So here, if you see, there are examples of good reporting. So they have example of writing randomized controlled trial, observational studies, systematic reviews, and then they have these guidelines which everyone should follow when they are writing those studies. So those guidelines have some, structure so you can follow, or there are the things which a reviewer is going to look at when they are reviewing your study. And then there are certain rules which journals want you to follow. So they can help. Everything is free here, whatever I'm going to show you, and it's open for everyone. So this is the same page. It's going down, and look at it, the general guidance on scientific writing. So we have compiled a collection of guides, books, courses, presentation to help you with this writing. So the publisher has produced a set of resources on writing and publishing. So now if I click this, setting the resources, so here we come, guidance of scientific writing. And then these are the guidelines, these are the books, these are the courses. So look at it. This is a free online course, biomedical writing course, and then reporting guidelines, simple power tool could increase your, so this is one of the example. There are so many, examples. So I also picked up this from their site. So this is Toolkit Writing Research, same website. Want you to focus on this part. So whatever study you're doing, so the title, it tells you what to do in there, abstract, objective, method. So copy paste this, and then just start writing, filling this out. Objective, methods, result. In methods, they tell you what to write. Then introduction, they tell you what to write in, just follow their instructions. Then methods, so it's just awesome, how they give you a framework: setting a location, participant, study design, outcome, statistical method, ethical issues concerned. So this is what all you need for every good journal. So you copy paste this and start filling this out. And then if you go to the other page, the results, then they give you another structure for that to description of study participant, present outcome, then secondary outcome, reports adverse events, outline which did not follow the pre-specified, everything. You just copy paste and start filling it. Discussion, again, the headings which I gave it to you, they're almost the same. Brief presentation of your findings, study strength and weaknesses, comparison to other studies, consideration of implications, clinical and scientific, suggestion for future research. Copy paste and just start filling it out. This is the conclusion, and then acknowledgement. So basically, you start from here: title, abstract, introduction, method, discussion, and then you copy paste their all headings and then filling it out. And here you go. You are gonna write an excellent paper on your own. And then they give you guidelines too. Like I will give you an example. Let me show you. So the if you're doing an observational study, first of all, you're doing, let's say, a retrospective study, then you can follow the stroke guidelines. Stroke tells you what are the journals looking for, what are the reviewers looking for, what should be there. And then Prisma is for the systematic reviews. If you're doing a systematic review, the Prisma protocol you need to follow, and a lot of journal wants you to do it. So that's why they have a checklist, so you can make sure you have all the components which are in the Prisma checklist. And then they have some guidelines for case reports too, which was interesting. I did not know about it. And so this everything is free. First of all, whatever you click, it's open access, it's free, so you can access it. So I will finish on this: to become a productive physician scientist who really does research for their career, you only need two qualities, only two. So what are those? So they are enthusiasm, like you're willing to do it, and then you're willing to learn new skills, because you will have to learn a lot of new skills on this path. And then if you are willing to do it, then that's all you need, and then you will be successful, inshallah. So these are my references, and I will take any questions.
Thank you so much, Dr. Bilal. It has been an informative session and a very basic one. If a person does not know even anything about research, if he goes through this session, he can have an idea about this. And fortunately, we have recorded this, and we will be uploading this on the official NRC channel. There is a person, Muhammad Qasim Qureshi, who wants to ask how to decide a journal for your paper when it is your first publication and not very good quality, and what things are needed to be considered in this.
So yeah, that's a very good question, Qasim. Uh, I think there are several factors. So let's say if it's my first paper, and then I am working alone. I will give you a scenario. If it's my first paper, I'm working alone, and then I already know my paper is okay. It's not great, and but it's publishable. Then that's a question too. I think it's publishable. It's okay. It's not great. So the first thing I will do, if I am doing it, so I will try to reach out to a person who has done a lot of research, and I will say, okay, so uh, uh, Dr. X, I have written this paper, and then what do you think I can improve? That will be my first thing I will do. And then let's say even if you reach out to me, for example. So I am a reviewer for a lot of journals, and I have done a lot of research, and I will be able to tell you what are the things you can improve to make it better. I mean, your main idea, your methodology may not be changed, but there are so many other things you can even change without changing the structure of the paper. So that will be first thing. Then then the once you have improved it, then I am assuming, again, we are thinking it's not that great. So then I will go to the Google and then I will find the journal rankings in the field of whichever paper is. Let's say if it's in the field of rheumatology. So then I will write in, literally, this is what I do. So I write in rheumatology journal rankings. So then it will, there is a excellent resource. When you put it in there, Google comes up with a Schmidgo, something like that, SCHMID, something ranking. They tell you the impact factor of every journal. They actually list it from 1 to 100. So then I look at the impact factor and then I will say, okay, my paper is not going to get published anything above 3. Okay, I'm sure it's not going to get published. So then I'm going to look at all the journals which are going to be less than 3. That's my first thing. The second thing I will look is that if let's say if I'm writing a case report, does not lot of journal take case reports. So then actually that website is going to give you a link to the journal too, and then on the first page you can find what kind of paper they publish. Let's say if they don't publish case report, then it's out. You can cross it out. Then you find another, because you already have a list there. You have 100 journals there, and then maybe you have narrowed it down to 20. So then out of those 20, that journal is gone. Then you go another. That's how I do it. I have done it. And in the end, it's very important that you understand that what are the goals of that journal. Is usually if you go to website and look at the journal information or about, like, if they like case reports or not. Some of the journals, like I was saying, they don't like the review articles written by, let's say, me or you. They're going to have they want the review article written by someone very prominent in the field. And then lots of journals don't even accept review article. They send an invitation for a review article. So those are the minor things you need to find through the website. But your start is going to be finding a person who can improve a little bit, your manuscript. And then after that, going through the list of the journals ranking in your field. It can be, nephrology, type nephrology journal rankings, pulmonology or general surgery, whatever it is, and then go from there.
Thank you so much, Dr. Bilal. So do we have any other questions, please? Well, Navera, you want to unmute? G.
Assalamu alaikum. Am I audible?
Yes, you are.
Yes.
First of all, thank you so much, Dr. Jawad, for such an amazing session for all of us. Sir, I have a question related to the data collection. Like I with my team has been associated with the research from last 3 years, and we have completed our one research project, and we are working on the second. And the main problem that and we say, please, we are doing this research, and you have to fill this form, and you have to share your data with us. So the main problem that we face is they are concerned about their privacy, and maybe, and due to their security issues, they don't share the correct data with us, and maybe due to the other factors, we don't get an appropriate data, due to which it might affect our results. So when we go towards the statistical analysis and all that, and it might have a strong effect on our hypothesis approval or the rejection. So how to tackle with that? Cause in our first project, this was a major problem for us to get an accurate data and all that.
So I'm going to repeat your question so that I make sure I understood it. So you are saying you're working with the research team and they have the original data, but they are not sharing it with you because of some HIPAA or privacy concern. Is that correct?
No,
No.
Is that? Hmm.
I am saying when go to the public privacy.
You mean that patient data, or the normal clinical data available online? We cannot hear you. Can you hear us?
Yes. I want to ask when we go to the public and we tell them we are doing a research and we want your data for this specific purpose. So we might concern the data they are sharing with us might not be
Oh,
correct.
oh, I
As
see. Okay, I see what you're saying. So you're saying if you go to a patient or anyone getting the data, like let's say if you have a survey form, you want to fill it out, and if they gave you the wrong data, is that correct?
yes.
Okay, so so I will tell you, you brought up an important issue. So there are several things to consider about sharing data. So that's what I was saying. I think I did not include it. So there is a patient data, which comes from the hospital directly. Let's say, I don't think so Nishtar has electronic medical record. So let's say if some Shifa has under electronic medical record, you want to access patient data from that um, database. That's a one scenario. Then the second scenario is that you have all these randomized clinical control trial observational study, everything on the PubMed, which is published. So you want to access that. That's a second thing. Then the third thing is that in what I understood in your case, you are talking to the patients directly. Let's say, I'm just going to give you an example. Let's say you have you're asking patients the reasons why they are not getting the COVID vaccine, and you have a survey form, and then you want them to fill it out. And then, so those are the three different scenarios. So in your case, whatever patient is going to tell you, or whoever is your data source, it's a patient, a student, you're doing a student survey or you're doing a doctor survey, you will have to take it, because there is no way of going around it, even if they are withholding the information. So let's say if if you're asking someone why they don't want to get a COVID vaccine, and they may not tell you the right reason, but they are telling you, oh, because I don't have money, or I don't have time. So that they are not be telling you the real reason, but this is what they're telling you. So you just have to take it, because this is what they officially on the record told you. So then the second part is, if anything available on the PubMed or on the Google, it's you can use it essentially. The only part comes in that when you cannot access the full text articles, then you can ask your there are different resources you can use, or you can ask your research team, they can help you. Then there is a third part. I gave example of Shifa because they have electronic record system. So if you want to use their data, so then you remember I talked about the ethical board review committee and all that. So that comes there. You usually, every institution have a forum. You need to fill it out, that if you want to access data of the patients who were seen in Shifa, then you need to tell them why do you want to do it, what are the objectives of the study, and then what are the benefits patients are going to get, and then how you're going to do it. And then they usually are very careful, like at least say about the patient privacy, and then their data leak. So they ask you how you're going to de-identify the data, how you're going to make sure that data is not leaked or gone into someone hand who is not part of research. So that's very tricky. So that's where it comes. Did this answer your question, Actually, you're cutting too, so we're trying to understand, right.
Navera, are you there?
Yes, I am here.
Did it answer your question?
Yes, it answered.
I mean,
Thank you.
yeah, what I understood, but I mean, you're in a difficult position. But the problem is that what can you do? If someone is just telling you, this is what they want to tell you, basically.
Yes, exactly. Thank you so
Yeah,
much.
yeah. The other way of going around this is that, I mean, now I don't know what are the, design of your study, but you can change the design. Let's say, I will give an example. So, let's say you have uh, um, 30 year, you are looking at all the adults who are using the COVID vaccine, and then you want their response that why they are not using the COVID vaccine. And then you think that they're not answering you right. So then you can go back and then, edit your study design. You say, I am only gonna, ask this question to people who are graduate here. You're gonna say, I'm gonna exclude everyone who is not graduate. And that's, I'm just giving you one example. And then the other example can be, you can just say, oh, I'm gonna exclude everyone who lives outside outside of, let's say any particular area, like close to Nishtar, like Kent. Anyone has any questions? Just start doing it. You will learn by doing it. So just do it. And then you will learn everything, along the journey. And so good luck to all of you.
G. Well, Hafsan, I see you want.
So I think someone asked, yeah.
You can read, please. How to write in scientific language? Kindly suggest some ways to learn it.
Yeah, so I a little reading, like you have internal of medicine. Again, if you don't know that which ones are the good journals, you can just type in Google and say what are the top 10 medicine journals in world. It's going to tell you these are the journals, JAMA, and then you are in a great time, because a lot of research on, I mean, every research on COVID is free, so you can access those articles. And then there are a lot of open access articles which you can read, which mean you can read the full text without having access to the journal. So that's the best way of doing it. And then you can do some courses too. I showed you the Equator website. That's one of the example. They have a free, actually I clicked on it, I just wanted to see what it is, and then I saw there were modules there. And then so you can do those online free courses too. And then then in lastly, when you have done all these, or you're, reading, so then you just not start doing it, and then compare your, article, what you wrote, to the other articles, what, publish in JAMA, let's say case report published in JAMA, or sometime in New England Journal published case report, to very novel case reports, that you can just read that. And that's how, you're gonna improve. I mean, initially it will not look as good, but it's just going to improve as you go along.
Well, thank you so much, Dr. Bilal. Well, there is a question I want to ask, that how
Yeah.
something let's talk about myself. For anyone who is into research as an undergraduate medical student and is interested, can get a good career in being a physician scientist, being a researcher and a physician as well. As well as
So yeah, so I think that a lot of us don't think about it when we are in med school. I never thought about it, and it's about a culture and, environment. But if, we start thinking about it, it's not difficult to actually do it. I will tell you a very quick way of doing it. So like I was saying, join Twitter, and then the other is that contact all the people who are doing research, and then ask them if they have any full-time position for a research associate or a fellow or assistant. That's what they call it. It's one of the same things. And then uh, you may get unpaid position initially, but if you work good, then it's going to get paid. And then if you're lucky, most of the people get paid position from the start. So then they're going to ask you, how much do you want to commit? If you really want to become a physician scientist, then try to commit at least for 2 years. So you accept that position, you commit for 2 years, and then you will learn everything almost, along your journey. And then once you have spent those 2 years, hopefully you will have a publications, or you will have a basic science research experience. You will have something, in your toolbox. You will have a lot of skills. And that's when, you start collaborating on your own with others. And then you may create one of your small team, because then you will be experience a little bit, and then you collaborate with the other teams. And that's how you just keep doing it. And then I was giving you example of Rasim Tariq, and there are so many other people. I know a lot of people from Dow, have contacted me. Dr. Riaz and I work with a lot of people from Dow. They do it like that. This is what they're, they have like now a set up a system. And there is a Dow student who just graduated from final year. He came here in Phoenix, close to my city, and then he's working in Mayo Clinic, and he committed for 2 years. And then I tell you, when I talk to him, even after working, he worked for a year. The guy knows now all the skill needed for the research. Yeah, I really like him. He's very smart. He's learning things. And I think by end of 2 year, he's going to have 20, 30 publications. And then even if he starts working on his own, he's going to be all set. And especially if he get a training. But you don't have to, I'm just giving you example of my surroundings, but you can identify someone, let's say in, in your institution, or, somewhere, King Edward or Dow, or, other institutions, you know people, and then start, doing some clinical research. I know in our institution, the culture is not that, great. So that's why it might be difficult.
Thank you so much. There is Asrar who wants to ask, as you can read, how is writing a scientific textbook is different from research, and what is in the book counts as plagiarism?
So if you're writing a book, uh, so if you're writing a book, let me, try to create an example. So because like I just wrote a chapter in a book about osteoarthritis. So most of us, it's difficult to write a textbook. But now I'm thinking maybe you're like, say, if you are just writing a book for multiple choice questions or something like that, then that's completely different. Actually, that may not apply. So I will give you that same example of mine. So I wrote a chapter in a book, which is a textbook of rheumatology. So I wrote osteoarthritis chapter. So osteoarthritis chapter, when I was writing it, is writing as a review article. It's another review article, you need to think. So whatever you read, let's say in Harrison, or in Davidson, or all the books. So there is an author who wrote that chapter. Let's say there is an author who wrote about osteoarthritis, and that's his point of view, his or her. And then they have written a review article themselves. It's just a review article. That's why I kept saying that if you want to know about a one topic, you need to read it from different resources, because I may present the data in a one way, then Abdullah may present in another way, and we have Hafsa may present in another way, and then Asrar may present in another way. So although it's the same data, but everyone is just going to present in their own way, or it's the same disease, everyone just going to talk about in different way. So writing a chapter or a topic in a book is just like writing a review article. That's how I see it. And it's completely same rules as you follow for scientific medical research. And then plagiarism, I did not talk about it. I just wanted to go into the basics. But let's say if I have done a study, and I have found out that smoking increases the risk of psoriatic arthritis by 10 times. This is my main conclusion. And then you are writing a chapter in your book about psoriasis and psoriatic arthritis. Now, if you are writing a review article, and if my article is good enough, you're going to quote it, you're going to reference it, right? You're going to say, oh, Bilal et al. Found that there is a 10-time increased risk of smoking, psoriatic arthritis with smoking. So you are quoting me, you are using the same conclusion what I have, but you're going to put a reference, and then you're going to come up with your own way of describing it. You're not just going to copy the my main conclusion from my article, where I said, oh, smoking increases the risk of psoriatic arthritis 10 times. You're going to say in your own words, in your review article, what you're writing in your textbook, that, oh, Bilal et al. Evaluated 500 patients of psoriatic arthritis, and five who were smoking, and then 500 who are not smoking. And then in their conclusion, they found that there is 10-time increased risk of psoriatic arthritis people who smoked, and compared to people who did not smoke. So this is your own interpretation of my data, although you are using my data, and then you're going to quote it too. After that, you have to put a reference there, that the study. So that is not plagiarism, because all the review articles, that reviewer mostly have not done, I mean, most 99% time he has not done all, he or she has not done all the studies. They are using other people data to give you most up to date uh, findings on the disease. So they are using other people data, they're just quoting it, they're putting a reference. So you can do it.
Thank you so much. Sir, I have a question. How can at this level can we go into case study? If we go to some our doctor, senior or doctor, and ask him to let us see some patient who has a different disease, and can we, as an undergraduate medical students, go for the case study?
Yes. So you can do case series. So I will give you an example again. If you have COVID-19 infection patient, COVID-19 patients, and then you have seen in your, let's say in your medicine ward, that they are getting pulmonary embolism, although now it's known that they can get clotting. I'm just giving an example. So this is a new thing, which no one knows. So then you can start collecting the information on those patients, and then maybe it's going to take a month or two. You have to decide how long you want to collect it. So if you have 4 or 5 patients, And then you have seen that they have COVID-19, and then they're going to have a pulmonary embolism with COVID-19, and you have excluded all the causes, other causes. And then you think it's related to COVID-19, you can write those case reports. You don't need to get any ethical approval from Nishtari Medical University. You do need to get the patient consent, because if you want to publish it in a good journal, all the good journals require a patient consent for case report or case series. Case series, sometimes they require ethical approval too, because it's one or more patients. So they may ask you, but it should be easy. And I assume in Nishtar, you just have to come up with what you want to do, and then get a signature of whoever, is the head of your research committee. And then, but if I will give another example, if you have a case which is very interesting, and let's say if there is a very rare finding of a disease you see, so you can just write it on your own. You just get a patient consent. You don't even need your any faculty, to be involved too. I mean, it's good to involve them, because they are going to give you a differential diagnosis, and they're going to tell you why it is. And but then you need a patient consent, and then you can write it, and then all the
Okay.
labs. But data has to be accurate. Remember that, you'll have to have all the differential diagnosis excluded, and everything kosher. It has to be. Otherwise, they are very careful accepting the papers from other parts of the world.
Thank you. Miss Hafsa just wants to ask something, maybe. Miss Hafsa, you can unmute.
Thank you so much, Dr. Bilal, for the session. I just wanted to ask, like you said, for research we can do research for our career prospects too. So if someone wants to do like a fellowship in, for instance, infectious diseases, but he's not getting the research in that particular area, but maybe get a research in hem-onc or something, would it like impact like when we are applying for like residency positions and stuff? Like, does the research has to be specific, or we can just start our career in research with anything, like if it is in hem-onc or rheumatology or anything related to internal med? So does it impact really, or do we have to like target specific research if we have something specific in mind for future?
Yeah, that's a very good question. So, so I come up with this scenario a lot. So whenever I'm interviewing, I'm going to tell you my personal experience. So when I'm interviewing for fellowship candidates in rheumatology, and I look at their application, and I see that, they have done, let's say they have done a lot of research in hematology, oncology, and or gastroenterology or infectious diseases. So the first thing come into my mind that, this person has a potential to do it. If let's say if they become my fellow, they will do it, and then they know how to do it. So it's always a positive thing, on your CV when you have done something. But then, so if you ask me, the best is that you do it in field which you really like. But in reality, you know in developing countries like ours, we don't get that many opportunities. So let's say if I'm just giving example, if you start working with Dr. Zishan, he's a psychiatrist, and then because the opportunity you got in the psychiatry, and then so that will count. I would, if I have that opportunity, I have not done anything, I would do it with, even in the psychiatry. The reason is that the first thing I told you, that whoever is going to review your application, they're going to say, okay, this person knows how to do it. The second reason is that you're going to learn a lot of skills by doing research in any particular field. And then once you have those skills, then you can actually mold it to for your own, field too.
Yes, makes sense. Thank you so much, Dr.
Mm.
Well, thank you so much, Dr. Bilal. I think there are no more any questions. Last question I would like to ask, that as you mentioned, that we don't need to publish all articles. We can also do some research and present it at some conferences. We also did recently. But if we do some research and don't publish it, but we only present it in different conferences, is it also beneficial?
Yes, because it's, there is a section. So, I mean, I am assuming you are asking when of the job prospects, the training.
Yes.
So when you're applying, there is a section of the conference presentations too. And then you put them that, there was a poster, annual poster session at Mr. Medical University, and then you presented a poster there. So you can put that there. And then, if there was a poster in, in Pakistan of, whatever field you're interested in, infectious disease, national infectious disease conference, and then you presented a poster there or a presentation, that's going to count too. You can put it there. And like I was telling you, a lot of, big conferences, international, like American College of Rheumatology or, gastroenterology, oncology, they publish every abstract. So poster is an abstract, right? I mean, abstract, you are making a poster in a pictorial form. They publish that abstract too online, so it's going to be there. So that's also helpful. As far as you can, you always tell them, oh, I have a plan to write it, and you hopefully are writing it too, because you have done the main thing, coming up with an idea, doing analysis, writing the main methods and conclusion. You have everything, but in a page, but now you can expand it in a paper easily.
Well, thank you so much. I think we should be concluding it. Thank you so much for the session, Dr. Bilal. It has been very helpful, and you have basically guided it from the basics. Even if a person who does not know anything about research can understand. Also, we didn't get much audience because of the students are busy and perhaps profs are ahead, professional exams. However, I think I missed the connection in between, so I hope the recording is not lost. But I suggest that after the prof of students, we should be carrying out sessions in parts. As you see, you did it all in one session. But if we can do it in parts, students can learn more. So that will be more beneficial and helpful. And about research environment at National Medical University. So you would be glad to know that it is establishing, and we are the example of that in front of you. My team, Hafsa, Nasir, and Navira Ayub, who ask questions, are from my team as well. Maria Siddiqui and the Amna Mahmood bhi hai usme. So basically, Dr. Hamid Hassan, as you would have known, is guiding us and mentoring us in this. We have been able to present our work in recent conferences, in the International Conference of Psychiatry a few days ago. Dr. Islam was also there, and as well as Pakistan Physiology Conference. And our VC, current VC is also very supportive, and moreover, just आप लोग NRC जो है support कर रहे हैं वहाँ बैठ के हमें. So I think it is a time we should start this culture and keep it moving. And as you guided, we can make it in form of short courses as well at Nishtar at very local level, and it will be helpful to students क्योंकि हमारे पास भी बच्चे आते हैं हमसे कहते हैं हमें सिखाएं. At the end हमें इतना नहीं आता. We need to learn as well. लेकिन जितना हमें आता है उतना हम सिखाते हैं. Still, if it is to be in systemic way as you taught us, it will be better. So thank you so much, and I would like if you can extend your email in the chat box. Ask question.
Glad to be here, and then I can do it again whenever, if you think you can gather more people. And I'm glad, that things are improving there. And then hopefully that's a goal. That's why we are doing all this too. Let's see.
I would send a mail so that if you can share the slides too as well. They're very helpful.
Yes. Yeah. Oh, why is just letting me send a message to you? Not
you can change it to everyone as well.
Yeah, now it is.
Yes. So anyone who wants to ask any query or is interested to know more or any questions can send a mail to Dr. Bilal. Thank you so much, sir, for your time and your patience.
Yeah, it was an honor. Yeah. So good luck, everyone.
Thank you, sir.
Yeah, Allah Hafiz.
Thank you so much. Perfect.